Welcome back to my channel, taking you on my journey as a medically complex mom. And today we are doing part 3 of my Pfeiffer Syndrome facts. So my goal is to really educate you on what Pfeiffer Syndrome is from my perspective. So again, I am not a doctor. I have learned this from doctors and research, but if you want the exact wording and everything, definitely look it up yourself. But I will tell you what I know. So definitely take a look at part 1, where I tell you what Pfeiffer Syndrome is there a cure? Part 2, where I really break down the treatment to it and the surgery she's had. And today we're going to talk about delays, those words, disabilities, special needs, medically complex, and really break it down to really what she's going through. And I've always tried to be very explain to you that everything is about the kiddo itself, that there's no broad view of Pfeiffer Syndrome. So for my little one, does she have delays? Yes, she will. And a big part of it is because of the physical things that Pfeiffer Syndrome has created for her. So if you have a chance to watch the other videos, you'll see that she's got cranial synostosis, so she's got some breathing issues. And with that, she has a tracheostomy. And so that trach sits below her vocal cords. So she's not able to speak how we do because air does not go through her vocal cords. So she's a little delayed when it comes to talking. And then when you're hooked up to a trach in a vent, she's got the circuits all around her. So she's not able to move like we would do. So when you've got a circuit attached to you and maybe different wires, it's not easy for you to go left to right. And then lastly, some of her physical disabilities that she has is she's got fused elbows. So it makes it harder for her to crawl on all fours. It's going to be more of an army crawl. But as you're seeing, a lot of things she's going through, there's ways to modify and adapt to it. She's just got to learn. And with the help of myself, my husband, our nurses, and our therapists, we'll get her to there. So with special needs, there's 4 different little categories that qualify you as special needs. There's the physical aspect, developmental, the emotional, behavioral, and then the sensory impaired. So as I just explained, the physical aspect, the elbows and all of the things attached to her make it hard for her to move physically. Will she be able to walk? Yes. I am all about setting just high goals for her and always believing that she can do anything that she puts her mind to. I don't believe that Pfeiffer Syndrome will set her back if we work with her. Will she have maybe take a little bit longer and make it harder for her to do so? Yes. But is she capable of doing it? Yes. She's an active little girl. She's very mobile. She's constantly moving those legs. She stands up. She does some squats. So she's a strong girl. Maybe will she walk a little bit later? Most likely, because of the circuits and things attached. But yeah, I always get that question, will she walk? Yes. And then as far as the developmental side, we have been so big on protecting her brain, doing those surgeries early. So her brain health is amazing. We had an assessment and she is cognitively doing a lot of things that other kiddos do. And so we don't have any concerns there, and we just have to continue to monitor and watch that. But she's a very smart kiddo. She's already shown us that, with having fused elbows, maybe there's certain things she might not be able to reach and touch. She takes this other hand, she'll push this to her mouth, and so she's already problem solving. So the brain is functioning very healthily and very nicely. Emotionally and behaviorally, so far she is great in those categories. She does respond to human reactions. She loves to play with her mom, with my face, with her dad. She smiles when we smile, so she responds to that. So that's part of that emotional behavioral aspect. Does she cry? Yes. Can we see the tears drop but we can't hear her? Yeah. So she definitely gives us those signs behaviorally of if she's upset, if she's sad, if she's hungry, if she's sleepy. And right now, those are those key signs for a strong behavioral assessment. Lastly, sensory impaired. So this is one of her key ones. Sensory goes with vision and hearing loss. She does have hearing loss. So with Pfeiffer syndrome, it's all of this like fusion of bones. And one of the things that is really narrow for her, just like her nasal bridge in the back of her throat, is her ear canal. So she's got a very strong ear, I guess I should say, hearing muscle. She can hear when it comes to the brain connecting to that nerve. That's the word I'm looking for, nerve. But her ear canal is so narrow that sound does not travel through to beat on that eardrum, to take that noise and move it to her head to tell her what she's hearing. So for her, she's got a Baja band that she wears that has a little conductor box, and that is taking the vibration off of her bone and taking it to the nerve and to her brain. So it's serving as that eardrum for her. And over time, maybe that ear canal might get bigger, but most likely she will have some hearing loss issues moving forward. There's different surgeries that she can have, but right now, that's not what we're focused on. We have the Baja band because it's a very easy way to solve that complication she's having. When it's off, she does have very significant hearing loss. When it's on, she can hear everything that we can hear. She can hear speech sounds. So for the first 6 months of her life, she was not hearing voices and speech sounds. She could hear loud noises. So she's catching up nicely and being able to respond and understand what my voice is. But it took us time to really help her understand that my voice was coming from me, or to turn to noise. She wasn't doing that for a while, and now she's starting to really get used to her hearing aid, and she wears it all the time. And she didn't have any reaction to it. I think that's always a big question of, did she have some shock? No, she responded really nicely, and she was actually just like really excited and said so much joy to hear me and my husband's voice. The first day she had it, about 4 hours later, we went into her room and we were talking to her, and she just like lit up, looked from room to me, back and forth. So she is loving hearing, and ever since she's got her hearing aid, she has just been cognitively hitting those next steps. And now we're working on her understanding objects and words, and so that is a dog, that is a book. So we do use ASL with her, just like typical baby sign. And it's not something that she'll have to use permanently, because as long as she has her hearing aid, she'll be able to hear those sounds and voices. But it's just something that we do as a backup for her, that we want her to be versatile in how she's able to communicate with others. So that's a sensory that, she is impaired. So that's one of her special needs that she has moving forward. When she gets to school, she'll probably sit in the front, and she'll probably need to make sure she's got a clear view of the teacher so she can see her lips and be closer to who the teacher is and those sounds. But everything that she's going through, the doctors feel that she will be up to par with other kiddos by school age. So when it comes to walking and hearing and talking, that is our goal. So as I said, talking. Can she talk? So with the trach, it sits below her vocal cords, so air doesn't move through. So speech and language was one of those categories that she's delayed in. And that's just mainly because physically she doesn't have the ability to really push that air through and make those like strong noises that we can in sounds. She can a little bit, but not all the time. So once she gets to that point where she has that monoblock, so if you watch part 2, you know what monoblock is, then she will have the space in her throat and her nose to breathe, and our goal is to get that trach out, and then she will be able to talk and communicate just like you and I. But the brain is functioning, so she can hear and she knows the sounds, but we'll have to work on her with actually making those noises and those sounds and those words. So you're probably wondering, how are you able to keep up with all of this? How do you know all of this? So we had an assessment with a local nonprofit that works with kids who, because of their health complications, whatever syndromes, pretty much puts them in a category of having some special needs or disabilities where they will need help and assistance. And what's great about this organization is that they're all about being in front of it. So it's called Birth to 3, and they work with kids in those early stages so they don't get too far behind. So by the time she hits kindergarten, she is caught up, and we're able to work with her to get her to that point. So because of COVID, we do telehealth. So we've got a speech and language therapy, and we've got occupational therapy as well as a parent communication therapy to help myself and my husband communicate with our daughter through sign language. So we have it once a month for an hour, and it's via Zoom. So we have my daughter there, the nurse, and our therapist, and she works through different exercises. So for instance, we're really focusing right now on getting Clea to sit up unassisted. So she teaches us different exercises to help her build those muscles. Or tummy time. Tummy time is hard for her because of the trach, because of the G-tube. It's a lot of pressure everywhere. And so she helps us get her into different moves and like positions that are more fun for her, but also build up to the more intense tummy time by herself. So they're all about just providing us that guidance. But they also do a little write-up, give us exercises and notes to do when they're not there. And so that's on myself and husband and nurses to make sure we're helping her when we don't have that one-on-one session. And it's just like a private coach. Just like you guys would do with your child, we are here to serve her and help her excel and do whatever we can to make sure that she has all the resources to get to where she needs to do. So that is kind of the therapy that she has and how we're able to help her hit those big milestones. But at the end of the day, we are all about giving her patience and grace, and know that a lot of things are out of her control, and not putting any kind of timeline on her life and her milestones. And I think that's key for all parents, not to put that pressure, to give them that support, but not put the pressure on them. And so we make things fun for her. We support her in her activities, and we're just always giving her that break when she needs it, but giving her enough push to know that, hey, it's time to put some work in. I'm a coach, so I love to kind of work with her on those activities. And we just know that at the end of the day, it's like personality wise too. She's a fighter. She's a strong girl. She's all about like finding ways and doing things on her own time. So I truly know that she's capable of everything in the world, and she will do it when time is fit. So thanks for tuning in. This was all about our developmental delays, any disabilities, but also real quick, disabilities. So disabilities is a little bit more of like that physical aspect of it. So how you move around versus how you're able to do things. So disabilities, when I said earlier, some of the fusion in her elbow, that would be considered one of her mobility disabilities. But moving forward, we really won't know about walking and all those kind of things until we get to that point. She's only about 8 months now, so we can't control the future and know about how she gets from A to B, walking, crawling, and things like that. But again, thanks for tuning in for part 3 of my Pfeiffer Syndrome facts. I'll have one more coming up to kind of wrap up all that I know about Pfeiffer Syndrome, and I appreciate you for tuning in. Don't forget to subscribe below if you want more.